In this series of videos, we will read the Care Certificate workbooks, both what you need to know and what do you know now. This video covers Standard 9, Awareness of Mental Health, Dementia and Learning Disability, what you need to know, and it's over to my colleague to read through this workbook.
The Care Certificate, Mental Health, Dementia, Learning Disabilities, what you need to know. Standard 9, the Care Certificate Workbook. Awareness of mental health, dementia and learning disabilities. This standard aims to make you aware of people's experiences with and the causes of mental health conditions, dementia and learning disabilities. While you may not be working in a role that directly supports people with mental health, dementia or learning disabilities, it is important for all health and social care workers to be aware about these conditions. This is so that any signs and symptoms that you notice are passed on to other workers and that you show compassion and understanding when you experience any behaviour that you may find difficult to understand or respond to. If your organisation provides care and support for individuals with mental health conditions, dementia or learning disabilities, further specialist training should be provided. This will help to deepen your knowledge and develop your skills and abilities to meet the needs of your role. It may include opportunities to undertake specialist qualifications. Speak to your manager for more information. Mental health conditions. There are numerous mental health conditions, including psychosis, depression, mood disorder, and anxiety. In any year, 1 in 4 adults in Britain will experience at least one mental health need. Mental health. Mental health can be seen positively, to identify a positive state of mental well-being, or negatively, to identify a negative state of mental well-being. For example, experiencing mental health problems that cause distress and affect an individual's functioning. Depression. Some people think that depression is not a condition and that it will simply go away. This is not true. It is an illness with recognised symptoms, but it is treatable. Most people experience feelings of sadness or being down. However, living with depression is different. An individual experiencing depression will feel emotions such as hopelessness and negativity that don't go away. Symptoms of depression can last for a couple of weeks, a number of months, or longer. Living with depression can affect how the individual sees themselves. This can lead to them not engaging in social life with their family or work. There are treatments available to support people with depression. In some cases, having the opportunity to talk and share about how they feel can help. There are various organisations that support individuals who are experiencing depression and can provide further information on the condition. One example is the Depression Alliance. So that's their website. You can have a look on there by clicking the link. Anxiety. Feeling worried or anxious is normal. Many people experience things in life that create these feelings. However, those living with anxiety find it difficult to control their worries. As a result, they may feel that things are worse than they are. This can create a number of other symptoms, including physical symptoms such as increased heart rate, difficulty breathing, and dizziness. Psychological symptoms such as feeling a loss of control, thinking that they might die or have a heart attack, and feelings of wanting to escape or run away. Cognitive symptoms such as changes to your thought process or thinking negative thoughts repeatedly. Behavioural or social symptoms such as not wanting to leave the house, abusing substances such as alcohol or drugs, or behaving in ways that affect relationships. Individuals may stop going out with friends or to places such as the supermarket as they are worried about how they might feel when they are there. Psychological. Psychological symptoms relate to feelings and emotions. It includes how the mind looks at things and how this can affect behaviour. Cognitive. Cognitive or cognition refers to how the brain and how we think about things, how we process, use and store information we take through our senses. There are treatments which help to alleviate some of the symptoms of anxiety, such as cognitive behavioural therapy, CBT. This helps someone to talk about their condition and manage the effects by trying to change the way they think. Cognitive behavioural therapy. This is a type of psychotherapy that looks at how you think about yourself, the world, and other people. Altering how you think can alter how you feel and behave. Psychosis. Psychosis is a symptom of conditions such as schizophrenia and bipolar disorder. NHS choices say that around 3 in 100 people will have at least one experience of psychosis. Schizophrenia. This condition can be described as having a break from reality, when it is difficult for a person to understand what is real and what is their own thoughts. Symptoms could include hallucinations, delusions, and changes in behaviour. Bipolar. This condition affects a person's moods and means that they can go from one extreme mood to another alongside having feelings of depression. There are two significant signs of psychosis. Hallucinations, where a person sees or hears things that aren't real, but are very real to them. They can also include feeling, smelling, or tasting things that aren't real. Delusions, where a person believes things that aren't true, for example, believing that someone is spying on them. These experiences can be frightening and lead to behaving in ways that others find strange. One way of supporting someone who is experiencing hallucinations or delusions is to recognize what they are saying or doing is real to them. Rather than telling them you can't see or hear what they are seeing or hearing, let them know that you are there to help and that they are safe. This could avoid them feeling like you don't believe them and could help ease their stress. Although you do not share in their hallucination or delusion, you do know that it is a real experience for them. Most symptoms of psychosis will get better with treatment. However, in some cases, people may have to be admitted to hospital for treatment and support and to recover. If your organisation provides care for people with psychosis, speak to your manager about how individuals' needs are assessed. An individual may experience a mental health need as a result of a traumatic event such as an accident or a death in the family, or as a result of war, a chemical imbalance in the brain, genetics, for example, a person's additional needs may be due to their DNA. Chemical imbalance. The chemicals or hormones that affect our emotions and behaviour may be lower or higher than they should be. However, the significance of any such chemical imbalances is highly disputed, with the result that there are professional disagreements about how effective various mental health medicines can be. Mental health problems might be as a result of a specific situation, that is, reactive, but that is far from being always true. In any case, such conditions can vary from short-term to being lifelong. There are a number of organisations who are working to support people who experience mental ill health and can provide further information. These include the Mental Health Foundation, Rethink, and Mind. Okay, just showing the links. Dementia. The term dementia is used to cover many different conditions that affect the brain. The Alzheimer's Society estimate that there are over 100 different conditions that fall under the dementia umbrella. These conditions cause a decline or reduction in abilities, including memory, thinking, reasoning, and communicating. Someone who experiences problems with these abilities may feel confused, frustrated, and frightened. A common symptom is short-term memory loss. The individual finds it difficult to remember recent events or conversations. This can lead to them repeating stories or asking the same question over and over again. There are a number of different types of dementia, which can affect individuals differently. The experience of living with dementia is also affected by other people's attitudes and views. The flow diagram below shows how negative views of dementia can cause negative experience. If people view living with dementia as a constant loss of abilities, that there is nothing that can be done to support the person, then the person living with dementia will most likely experience feelings of ill-being that can then contribute to negative experience of living with a condition. There are many causes of dementia. Two of the most common types are Alzheimer's disease and vascular dementia. In an individual with Alzheimer's disease, a bad protein develops in the brain, causing damage to the brain and the connections. Vascular dementia is caused by oxygen failing to get to the brain cells as a result of problems with the blood supply, the vascular system. Although the symptoms of each type of dementia are different, all types of dementia are progressive. This means that individuals experience a gradual decline in their thinking, processing, and remembering skills. How gradual and serious this is varies in each individual and will be affected by the care and support they have. Dementia is often thought to be a condition that only affects older people. However, dementia can affect anyone at any age. In particular, individuals with learning disabilities are more likely to experience dementia at an early age. The Alzheimer's Society estimates that there are more than 40,000 people under the age of 65 living with dementia. And for more information, you can find out on their website at alzheimers.org.uk. Learning disabilities. Learning disability is a result of brain development being affected from birth, before birth, during birth, or in a person's childhood. An individual with a learning disability may have difficulty understanding information, learning new skills, communicating, and living independently. The experience of living with a learning disability varies depending on whether it is mild, moderate, or severe. People with a mild learning disability may only need support to be independent, while someone with a severe learning disability may not be able to communicate verbally and may need constant specialist support. Individuals may have other physical or sensory conditions alongside their learning disability and may have difficulty responding to feelings and emotions. They may express themselves in ways that others find difficult to understand, which can in turn affect how others see and respond to them. Learning disabilities can result from a number of causes, but the particular cause in any given person is not always known. Causes can include genetic conditions such as Down syndrome, which happens as a result of an extra chromosome. This leads to impairments in cognitive ability, physical growth that range from mild to moderate development disabilities. Complications during birth, which can lead to a lack of oxygen, which impedes the baby's development. Illness or injury in childhood, which has affected the brain, such as meningitis. In most cases, living with a learning disability will have a lifelong impact, but this will vary depending on the type of learning disability. Mistaking conditions. Some symptoms of living with mental health needs, dementia, or a learning disability are very similar, which can lead to conditions being mistaken for one another. The table below identifies some of the similarities. Psychosis. Confusion as a result of hallucinations and delusions, lack of insight and self-awareness, problems with sleeping. Depression and mood disorders, change in mood, personality, problems with sleeping. Anxiety, change in mood, personality, problems with sleeping. Dementia, confusion as a result of memory loss, change in mood, personality, problems with verbal communication, problems with sleeping. Learning disability, confusion due to difficulties with memory or relating to information, lack of insight and self-awareness, problems with verbal communication. Self-awareness. This means having an understanding of yourself, your feelings, emotions, and behaviours, and understanding how your feelings, emotions, and behaviours can affect others. Care and support. As each individual is unique with a different personality, life history, and experience, care and support should build on the individual's particular wants, needs, skills, and abilities. The experience of living with any of these conditions will be affected by the type of support someone receives. For example, if an individual with a learning disability is supported to use and develop their abilities, they will become more independent. Promoting positive attitudes. There is a lot of stigma linked to living with a mental health need, dementia, or learning disability. This can create feelings of loneliness or being left out of society. However, through focusing on the abilities and skills someone has, living with the condition can be positive and people can be supported to live well. It is important that you demonstrate a positive attitude towards all those living with mental health needs, dementia, and learning disabilities. You can do this by helping to reduce the stigma by making sure individuals are not isolated in social situations, promoting well-being for those living with the condition, identifying and building on skills and abilities the individual has, providing opportunities for individuals to feel empowered and in control. The social model of disability, positive attitudes, and person-centered practice. The social model of disability says that a person's disability is the way that organised society responds to that individual and their condition, rather than being their impairment or difference itself. This is different from the medical model of disability, which focuses on treating or trying to cure an illness. The social model looks for ways of removing barriers that limit life choices. When barriers are removed, people can work towards being as independent as they can, be included in and equal in society. These barriers could include the environment, for example, using pictures as well as words for signs and information. The impact of people's attitudes, for example, stereotyping all people with dementia as the same and assuming that they will all be affected in the same way. The impact of an organisation's approach, for example, ways of working that are set to meet the needs of the organisation rather than the individual. Accessible. Can the individual gain access or entry to a part of the environment, for example, a building, a room, or a specific service, or to information, especially written information? Stereotyping. The stereotype means to use labels that identify an aspect of a person or group, for example, their age, sexual orientation, ability, or gender, then using this label to make an assumption about them or a group they belong to. For example, all older people are deaf is a stereotype based on an assumption that as you get older, you are likely to lose the ability to hear. The social model puts the focus on the individuals and their unique needs and not on their condition. This person-centered approach helps develop positive attitudes in society. Adaptations. Health and social care organisations usually need to work together to provide for care and support needs. For example, there may need to be an occupational therapy assessment to find out how a person manages their day-to-day life and any adaptations to their home that might be needed, such as handrails in the bathroom. Emotional support may be considered for both the person living with the condition and their family or carers. This might involve arranging a befriender or a counsellor service. Practical information or additional services about the individual's condition, illness, financial and legal issues, and opportunities to plan ahead should also be available. Forums, charities, helplines, or support groups are all useful sources of support and information. Reporting concerns. If you think that someone is developing symptoms of a mental health problem or dementia, or if you think that the support needs associated with their learning disability needs reassessing, you should record this information and pass it on. Who you inform and how will depend on your workplace and your role. There may be other workers involved, so it is important to follow your agreed ways of working on recording your observations to avoid information being lost or misinterpreted. Agreed ways of working. This refers to organisation policies and procedures. This includes procedures that are less formally documented by individual employees and the self-employed, as well as formal policies such as Dignity Code and Compassion in Practice. When recording information, there are a number of points to consider. Ensure the information is accurate. It should be clear, concise, and legible. It should be non-ambiguous and state facts, not opinions or assumptions. The person involved should be given opportunity to contribute. Apply the principles of the General Data Protection Regulation 2016, which has been updated, and maintain confidentiality. The importance of early detection and diagnosis. An early diagnosis benefits the individual and their family and friends. It can support them to put the steps in place to maximise their quality of life. 4 benefits of diagnosis are described below. Clear up uncertainty. It can be upsetting to live with symptoms like memory loss and changes in personality, particularly if you don't understand why they are helping. As there are a number of conditions that have similar symptoms, it is important that an accurate diagnosis is made. Although the diagnosis can be hard news to hear, it can clear up uncertainty and help someone to feel more in control. Help the individual and their family and friends to plan. Planning for the future provides the opportunity to consider, discuss, and record wishes and decisions. This is known as advanced care planning. The individual makes plans about what they wish to happen while they are most able to, and be involved and make decisions. Identify possible treatments and therapies. An individual may want to consider taking medication, for example, to relieve the symptoms of dementia or depression. They may also benefit from therapies such as counselling or cognitive behavioural therapy. Provide the right information, resources and support. Through accessing information at an early stage, someone can make the best use of what is available, such as support groups. They can also identify financial support that they may be entitled to. Adapting care and support. If an individual is diagnosed as living with a mental health need, dementia, or learning disability, they are likely to need changes to how care and support is provided over time. This will ensure that care and support continues to be person-centred. Changes may mean that workers need to develop skills to support people who find it difficult to communicate verbally, for example, by learning Makaton. They may also need to learn how to use assistive technology like clocks and calendars, reminder messages, or locator devices. Of course, the individuals themselves also need support to learn how to use such technology. Makaton. This is a form of language that uses large collection of signs and symbols to support and encourage communication. Those living with mental health needs, dementia, or learning disability are more vulnerable to abuse. You should follow your agreed ways of working to make sure each individual is best protected from harm or abuse. Legal frameworks, policy, and guidelines. Legislation and a number of policies have been developed to promote human rights, inclusion, equal life chances, and citizenship of individuals with mental health needs, dementia, or learning disabilities. These include Human Rights Act 1998. This identifies the fundamental rights and freedoms that all individuals have access to in the UK. It ensures that those with mental health needs, dementia, or learning disabilities may be treated fairly with respect. And that's the website there. Care Act 2014. This puts a general duty on local authorities to promote the well-being of individuals. The Act makes sure that the care support provided to those with mental health needs, dementia and learning disabilities provides for their physical, mental and emotional well-being. It provides the focus on prevention and ensuring things don't get worse for an individual, providing information to ensure people can make informed decisions and ensuring that there are a range of services available to meet the person's needs. And then if you click on the link, that's the careact.gov website. The General Data Protection Regulation GDPR 2016, as covered in previous video, this has been updated. This ensures that the organisations maintain the protection of data. The General Data Protection Regulation makes sure that personal data held by organisations is kept confidential, not kept longer than necessary, and is accurate. This includes data about an individual's health or condition. The regulation gives individuals the right to see the data and information held about them. And if you click on the ICO website, and you'll be able to find the updates on this website. Safeguarding Adults National Framework. Safeguarding adults is about promoting people's welfare and keeping them safe from harm and abuse. Individuals living with mental health need, dementia, and learning disability are particularly vulnerable, and therefore services need to ensure they are working to maintain their safety. And then if you click on the link, Fundamental Standards of Quality and Safety. A guide developed by the Care Quality Commission, CQC, that describes the fundamental standards of quality and safety that people using health and social care and services can expect. Mental Health Act, 1983, MHA. In most cases, when people are treated in hospital or another mental health facility, they have agreed or volunteered to be there. These may be referred to as voluntary patients. However, there are cases when a person can be detained, also known as sectioned, under the Mental Health Act 1983, and treated without their agreement. The Mental Health Act 1983 is the main piece of legislation that covers the assessment, treatment, and rights of people with a mental health disorder. Being admitted to hospital under this Act is sometimes described as being sectioned. In 2007, the Act was amended to include community treatment orders as well as admission to hospital. Mental Capacity Act 2005 MCA. This Act protects people who need care or treatment but may lack the mental capacity to make decisions for themselves. Everyone has the right to make their own decisions, and the Act says that we must assume a person can unless an assessment is done which proves otherwise, whether or not we agree with that decision. When someone doesn't have mental capacity, the person deciding for them must do so with the patient's best interests. Care and treatment of people who lack capacity must be the least restrictive of their rights and freedoms possible. Deprivation of liberty safeguards. The Act applies to people aged 16 and over in England and Wales. It also provides guidance to support people who need to make decisions on behalf of someone. Mental capacity. A person's mental capacity is their ability to make their own decisions. Having mental capacity means that they are able to understand information and make an informed decision or choice. All individuals have the right to make their own decisions. However, sometimes it is assumed that because they have a condition that it can affect their cognitive abilities, they are no longer able to make their own decisions. The Mental Capacity Act 2005 says that care and health services must assume that the person have mental capacity unless there is good evidence to show that they have not. By assuming a person has capacity, opportunities can be provided to enable the person to make their own decisions, which helps them to feel empowered, confident, and in control. Advanced statements ensures that an individual's wishes are taken into account in the future. This is often referred to as advanced care planning. The purpose is to enable an individual to make choices and decisions about their future care and support in case there is a time where they are unable to make those decisions for themselves, for example, in the later stages of dementia. This can ensure that an individual is not given any care or treatment they do not wish to receive, but will receive the care they wish to have. Many employers will provide further training, guidance, and/or supervision to help health and social care workers understand mental capacity issues. Speak with your manager about opportunities to learn about this important area. Making an assessment of capacity. There are two specific questions that can help in assessing a person's capacity. 1. Does the person have an impairment or disturbance in the functioning of their mind or brain? This can include, for example, conditions associated with mental illness, concussion, or symptoms of drug and alcohol abuse. If so, does the impairment or disturbance mean that even when given appropriate support, the person is still unable to make a specific decision when they need to? The Mental Capacity Act 2005 states that a person is unable to make their own decisions if they are unable to do one or more of the following: understand information given to them, retain information long enough for them to be able to make a decision, weigh up the information available to make the decision, communicate their decision. This can be through verbal communication or by using sign language or simply blinking an eye. It is essential that an individual is supported to find ways of communicating before a decision about their capacity is made. This might involve family, friends, carers, and other workers. An assessment should be made based on the balance of probabilities. For example, is it more likely than not that a person lacks capacity? There are 5 key principles that everyone must follow when assessing capacity. These are: always assume that the person can make their own decision. Ensure all possible support is provided to make sure the person can make their own decision. Do not assume someone cannot make a decision because you feel they are making an unwise or unsafe decision. If it has been identified that the person cannot make a decision, someone can make a decision if it is deemed in the person's best interest. If a person makes a decision on behalf of the individual, this must be at least the least restrictive option. If you are supporting a person who is struggling to make decisions, it is important that you apply the 5 key principles. An assessment of capacity may need to be made when the person is unable to make a particular decision at a specific time. The Mental Capacity Act 2005 applies to supporting an individual to make both day-to-day decisions, for example what to eat, and complex choices such as around care and support or managing finances. A mental capacity assessment is specific to a particular decision, and the principles must be applied to individual decisions. It is important to remember that an individual may lack the capacity to make a specific decision, such as around finances, but this does not mean that they can lack capacity to make all decisions. Consent means giving agreement to or approval of a proposed action or decision, particularly after thoughtful consideration in order to give their informed consent. An individual needs to understand fully what they are consenting to, including the repercussions it may have. The process of establishing informed consent will vary according to an individual's assessed capacity to consent and the situation. Consent may be implied or explicit, and either written or verbal, and it has by definition to be given voluntary and in advance of the action or the decision being taken. Informed consent embraces the person-centered care values of individual autonomy, independence, respect, and choice. Only if you provide information in a way that respects someone's individual autonomy can they act independently and choose whether to give consent or not. The individual you are supporting might show their consent in a number of different ways. Implied consent means the individual is cooperating with you. For example, a person being supported to eat opens their mouth as the spoon gets nearer. Verbal consent is given when you are asking an individual if they are happy with the procedure and they answer positively. Written consent could be a signed consent form, but it is often a document stating the outline of treatments, procedures, support, or care that is proposed, which the individual signs to show agreement. For any of these forms of consent, it is important that the individual understands fully what they are consenting to, the pros and cons, alternatives, possible outcomes, and the likely consequence if they refuse their consent. Simply attending to an appointment does not constitute consent if the person does not fully understand what the appointment is for. Consent in children, healthcare. People aged 16 or over are entitled to consent to their own treatment, and this can only be overruled in exceptional circumstances. Like adults, young people aged 16 and 17 are presumed to have sufficient capacity to decide their own medical treatment, unless there is significant evidence to suggest otherwise.
Great work on finishing this What You Need to Know booklet. In this series, we also have the What Do You Need to Know activity booklet that follows on from this video.